This video is going to describe the role of the pancreas in controlling blood glucose levels. So, if you have an increase in blood glucose levels, for example, if you have a meal high in carbohydrates, this is detected by beta cells in the pancreas. These beta cells release a hormone called insulin. Now this insulin is released directly into the blood and it affects liver cells and muscle cells. And so when the insulin reaches these cells, it brings about responses including converting glucose to a storage compound called glycogen. This then lowers the blood glucose levels. However, if you have a decrease in blood glucose levels, alpha cells in the pancreas release a different hormone called glucagon. Okay. Still a hormone, so it's released directly into the blood, and it affects liver cells again. Now this glucagon brings about responses including converting glycogen, which is the storage compound, remember, into glucose. And this glucose is then used to raise blood glucose levels. This control of blood glucose levels is an example of negative feedback. Negative feedback is a control mechanism that reacts to a change in a condition, for example blood glucose, by trying to bring the condition back down to a normal level. In other words, reversing the change. Now people who cannot control their blood glucose very well are called diabetics. In other words, they suffer from diabetes. There are two different types of diabetes, type 1 and type 2. In type 1 diabetes, no insulin is produced. Think about the consequences of this. If there's no insulin being produced, the glucose can't be converted to glycogen, so your blood glucose levels are going to remain dangerously high. Therefore, sufferers have to inject insulin into the subcutaneous fat layer, which is just beneath the skin. Now this is often develops in childhood, and it's a genetic disease, and sufferers have to manage what they eat, so they're really controlling their blood sugar levels. Now in type 2 diabetes, it's where the body responds less well to the insulin. It's kind of becoming resistant to the hormone insulin. So insulin is still being produced by the body, but the body's responding less well to it. Now, there are some risk factors that can cause type 2 diabetes. These include obesity, having a high-fat diet, a lack of exercise, and also getting older. And in order to manage type 2 diabetes, you have to carefully watch your diet and also exercise in order to control your blood glucose levels.